Our spines are amazing structures. They hold us upright, allow us to bend and twist, and protect the delicate spinal cord that carries messages between our brain and body. But sometimes things can go wrong, leading to a condition known as vertebrae nerve compression. Imagine a garden hose with a kink in it. The water flow is restricted, right? That's similar to what happens when a nerve in your spine gets compressed. The messages your brain sends through that nerve get disrupted, causing pain, numbness, tingling, or even weakness. Vertebrae nerve compression is more common than you might think. It can affect people of all ages, often silently creeping up on you over time. Understanding this condition is the first step in protecting your spine and staying healthy. This image illustrates how vertebrae nerve compression occurs. The cushioned discs between the vertebrae, designed to absorb shock, can bulge or rupture, putting pressure on nearby nerves. Similarly, bone spurs, which are bony growths, can also impinge on these vital pathways. Two of the most common culprits behind vertebrae nerve compression are herniated discs and spinal stenosis. Let's break down these conditions. 1. Herniated disc. Imagine a jelly donut. The soft, jelly-like center represents your spinal disc, and the doughy part is like the tough outer ring. Now imagine someone squeezing that donut too hard. The jelly might bulge out, right? That's similar to a herniated disc. The gel-like center pushes through the outer layer, potentially pressing on a nerve. 2. Spinal stenosis. This condition is like a slow narrowing of a hallway. In your spine, the spinal canal, which houses the spinal cord and nerves, gradually shrinks. This can be due to bone spurs, thickened ligaments, or other age-related changes, and it can put pressure on the nerves, causing pain and other symptoms. These conditions highlight how vulnerable our spines can be. But remember, knowledge is power. Understanding these conditions empowers you to take control of your spine health. Vertebrae nerve compression can manifest in a variety of ways, and recognizing the signs early is crucial for effective treatment. Here's what to look out for. 1. Pain. This is often the first and most noticeable symptom. The pain can be sharp, shooting, or a dull ache. Its location depends on which nerve is affected, radiating down your arms or legs. 2. Numbness or tingling. Have you ever experienced that pins and needles sensation? Nerve compression can cause this, making your arms or legs feel like they've fallen asleep. 3. Weakness. You might notice decreased strength in your arms or legs, making it difficult to lift objects, grip things, or even walk normally. 4. Loss of coordination. In severe cases, nerve compression can affect your balance and coordination, making you feel unsteady on your feet. Remember, these symptoms can also be caused by other conditions, so if you experience any of these, it's essential to see a doctor for a proper diagnosis. Vertebrae nerve compression can stem from a variety of factors, ranging from sudden injuries to gradual wear and tear. Here are some of the common causes. 1. Age. As we age, our spinal discs naturally lose some of their water content, making them more prone to herniation. Additionally, age-related changes like osteoarthritis can lead to bone spurs and ligament thickening, contributing to spinal stenosis. 2. Injuries. Trauma to the spine, such as from a car accident or a fall, can cause discs to herniate or vertebrae to fracture, potentially compressing nerves. 3. Repetitive motions. Engaging in activities that put repeated stress on the spine, like heavy lifting or twisting motions, can increase the risk of nerve compression over time. 4. Obesity, excess weight, especially around the abdomen, puts added strain on the spine, increasing the likelihood of disc problems and other spinal issues. Understanding these risk factors can help you make informed choices to protect your spine and prevent future problems. Section 5. Diagnosis. Shining a light on spinal issues. Diagnosing vertebrae nerve compression involves a multifaceted approach, combining your medical history, a physical examination, and specialized tests to pinpoint the source of the problem. First, your doctor will ask about your symptoms, when they started, and any activities or injuries that might have contributed to the problem. This is your medical history. Next, During the physical exam, your doctor will assess your posture, range of motion, reflexes, and muscle strength. They'll also check for any areas of tenderness or numbness. Then, imaging tests like X-rays, MRI scans, and CT scans provide detailed pictures of your spine, revealing any abnormalities like herniated discs, bone spurs, or spinal stenosis. Finally, nerve conduction studies measure how well electrical impulses travel through your nerves, helping to determine if a nerve is compressed and to what extent. By combining these diagnostic tools, your doctor can accurately diagnose the cause of your symptoms and recommend the most appropriate treatment plan. Section 6. Age, Gender, and Spine Health. Unraveling the Connections. While vertebrae nerve compression can affect anyone, certain factors like age and gender can influence its likelihood and presentation. Age-degenerative changes in the spine, such as disc degeneration and osteoarthritis, become more common with age, making older adults more susceptible to nerve compression. Gender. Some studies suggest that men might be slightly more prone to herniated discs, while women might be more likely to develop spinal stenosis. However, more research is needed to confirm these trends. Hormonal influences. Hormonal changes during pregnancy can temporarily loosen ligaments in the spine, potentially increasing the risk of nerve compression. It's essential to remember that these are general observations, and individual risk factors can vary significantly. Consulting with a healthcare professional is crucial for personalized advice and treatment. Section 7. Healing from within. Non-surgical approaches to nerve compression. In many cases, vertebrae nerve compression can be effectively managed without surgery. Conservative treatment options focus on relieving pain, reducing inflammation, and improving spinal function. Medications. Over-the-counter pain relievers such as ibuprofen or naproxen can help reduce pain and inflammation. In some cases, your doctor might prescribe stronger pain medications or muscle relaxants. Physical therapy. A physical therapist can teach you exercises to strengthen your core muscles, improve flexibility, and correct your posture. This can help stabilize your spine and alleviate pressure on nerves. Injections. Corticosteroid injections, delivered directly into the affected area, can provide powerful anti-inflammatory effects, reducing pain and swelling around the compressed nerve. Lifestyle modifications. Making changes to your daily routine, such as avoiding activities that worsen your pain, maintaining a healthy weight, and practicing good posture, can significantly impact your recovery. These non-surgical options often provide significant relief and can help you avoid or delay the need for surgery. Section 8. The surgical solution, when surgery becomes the best option. While conservative treatments are usually the first line of defense, surgery might be necessary in cases where severe or progressive neurological deficits. If you're experiencing significant weakness, loss of bowel or bladder control, or other neurological problems, surgery might be necessary to relieve pressure on the spinal cord or nerves. Conservative treatments fail. If non-surgical approaches haven't provided adequate relief after a reasonable trial period, your doctor might recommend surgery. Recurrent symptoms. If your symptoms keep returning despite conservative management, surgery might be considered to address the underlying problem. Surgical options vary depending on the specific condition and its severity. Common procedures include discectomy, removing a portion of a herniated disc that's compressing a nerve; laminectomy, removing a portion of the lamina, the bony arch of a vertebra, to widen the spinal canal and relieve pressure on nerves; spinal fusion, joining two or more vertebrae together to stabilize the spine. Surgery carries inherent risks and a recovery period. Your doctor will discuss the potential benefits and drawbacks of surgery to help you make an informed decision. Section 9. Living well with spine health, exercise, diet, and prevention. Taking a proactive approach to your spine health can go a long way in preventing vertebrae nerve compression and managing existing conditions. Regular exercise, especially activities that strengthen your core muscles, improve flexibility, and promote good posture, can help stabilize your spine and reduce the risk of injury. Diet. Maintaining a healthy weight through a balanced diet can reduce stress on your spine. Additionally, a diet rich in calcium, vitamin D, and other essential nutrients can support bone health. Ergonomics. Pay attention to your posture, whether you're sitting, standing, or lifting objects. Use ergonomic furniture and equipment to support your spine and reduce strain. Listen to your body. Don't ignore pain. If you experience persistent or worsening back pain, seek medical attention promptly. Early diagnosis and treatment can significantly improve outcomes and prevent long-term complications. Remember, your spine is the backbone of your health. By adopting healthy habits and seeking timely medical care, you can keep your spine strong and enjoy a lifetime of mobility and well-being.